Good evening and welcome to the Economic Perspective, the debate show where my co-host and I, Pat Ferriolo, debate current topics through the eyes of the economy. We're also joined by Republican Jimmy Zubert and Democrat Ryan Lowry, two economists, to give in-depth analysis on the topic at hand.
And the topic at hand this week we'll be discussing healthcare, and specifically the Affordable Care Act, or most commonly known as Obamacare. This piece of legislation changed the health reform when it was installed in 2009. Since then, it has hindered economic growth, increased the federal deficit, placed new burdens on state governments, and discriminated low-income workers.
Wait, Pat, do you really think so? There are multiple people who believe the AFA, or Affordable Care Act, has increased health among Americans, giving them safety while also benefiting the state and local governments.
Well, it looks like we have a lot to talk about here at the Economic Perspective.
So Pat, why don't we discuss the general ins and outs of Obamacare for the people at home who don't really know about it?
Well, Kevin, I think it's safe to say that everybody in America knows what Obamacare is. It is the insurance policy. You would have to be extremely ignorant not to know the basic facts of this health reform for the Americans.
Now, I see where you're coming from. Most people would probably think that everybody in the United States would know about Obamacare, but I wouldn't be too sure. We actually had one of our on-field reporters ask the public whether or not they prefer Obamacare or the Affordable Care Act. And for those of you at home who don't know the difference, there is none. Obamacare is a nickname for the Affordable Care Act. So right now we're going to head over and see what general public had to say about their opinion on the two.
So the Affordable Health Care Act is still a better option than
Yes.
Obamacare?
Yes.
And why do you not agree with the Affordable Care Act?
Well, I think it's not really available for all.
So the Affordable Care Act is more affordable than Obamacare?
Just the name says it all.
Right. You would agree with the Affordable Care Act?
Absolutely. I think it's nice that everyone can afford it, and everyone should be able to afford it. But to force people to pay something and then doctors to make something, limiting their ability to do their job, that's kind of anti-American.
Wow, what an interesting video. It really does look like we need to describe Obamacare.
So Obamacare is the Patient Protection and Affordable Care Act of 2010. It mandates health insurance for all Americans. It expanded subsidies for middle-income families and taxes healthcare providers and higher income earners. Obamacare is the most comprehensive piece of legislation since the Social Security Act of 1935. It's named after President Barack Obama, who has championed healthcare reform since running for office in 2008.
To enforce a mandate, a 2.6% extra income tax is levied on those without insurance. To pay for subsidies, Obamacare increased some taxes. Those making $200,000 a year or $250,000 a year for married couples pay higher income and investment taxes. Many businesses pay more taxes as well.
There are numerous pros and cons to this form of legislation, and to take a more in-depth look at this, we're going to go to Republican Jimmy Zubert to discuss further. Jimmy?
Thank you, Kevin. I'm always honored to be on the Economic Perspective. There are numerous disasters that Obamacare brings to the economy. First is that the new spending grows the federal deficit. The projected cost of health starting from 2010 to 2019 is $940 billion. This number is extremely high in a country that spends most of their money on healthcare in general. However, with the loopholes in Obamacare, such as omitting cuts to Medicare provider payment rates, double counting savings from Medicare, and the Class Act and indexing benefits for general inflation instead of medical inflation, it is closer to $2.5 trillion.
Interesting, Jimmy. And also, there are an argument that Obamacare bends the cost curve in the wrong direction by increasing spending by $222 billion and increasing premiums by 10 to 13%. How else does this affect the economy, Jimmy?
I'm glad you asked. There are new taxes and mandates which will hinder economic growth. The law requires employers who do not offer insurance deemed adequate by the federal government pay a fine of $2,000 for every employee. Therefore, there has been a reduction of wages, jobs have been cut, and the economy is relying more heavily on part-time workers. All this is bad for the economy, shifting the economic growth to the left.
Thank you for your time, Jimmy. There are also arguments that include that since this is the first time Americans are required to purchase health care or pay a penalty if they don't, the law is unconstitutional. These regulations and laws grow the government control over health care as the law allows the federal government to dictate the prices that insurers set through new age rating regulations. Looking through history, government-sponsored enterprises are doomed to fail, and this could be another one.
Yeah, there are even numerous political leaders who believe that Obamacare is self-imploding on itself.
Our legislative work starts with repealing and replacing Obamacare and saving families from the catastrophic rise in premiums and debilitating loss of choice and just about everything else. And remember this for this room in particular. Obamacare is a disaster. The Democrats are up and they're saying, oh, they're putting up signs like it's wonderful. It's a disaster. I actually talked with Paul and the group about just doing nothing for 2 years, and the Dems would come begging to do something because 17 is going to be catastrophic price increases. Your deductibles are through the roof. You can't use it. You can't use it. And they would come to us, except we have one problem. We have to take care of the American people immediately.
That is very interesting dialogue from the president. The higher premiums will be a huge effect on the supply and demand graphs. Those that argue against Obamacare say that Obamacare creates discrimination against low-income workers. It also neglects Medicaid in a sense. Under the new law, Medicaid will be expected to all Americans who fall below 133% of the federal poverty level. A poor program in general is now becoming worse.
In some cases, folks are going to lose thousands of dollars of Obamacare subsidies if they work too much. And here's an example. If a Wisconsin couple, say in their 50s, make $62,000, $40 a year, around the median income, they would pay $211 per month for the cheapest Obamacare plan. That's great. I mean, that's really a bargain. But if they go $1 over that, $62,041 a year, they would pay $1,342 a month for the same plan, and that works out to an annual cost of $13,000 a year.
A terrible reality indeed, Pat, and a huge loophole in the system. Increasing taxes and offering health care for all will lower the wages of all workers, making a public that would not want to purchase, thus putting an economic shift left and hindering the growth.
Before we go into supply and demand graphs, my favorite part of the show, I might add, let us take a deeper look to the pro side of Obamacare. Some argue that Obamacare will increase the economic growth.
A lot of the horror stories that were predicted about how this was going to shoot rates way up and there were going to be death panels and all that stuff. None of that stuff's happened. And in 2 weeks, the Affordable Care Act is going to help millions more people. And there's no serious evidence that the law, which has helped to keep down the rise in healthcare costs to their lowest level in figures, is holding back economic growth.
That was a good video. And now, here to discuss further on this topic, we have Democrat Ryan Lowry. Ryan?
Thank you, Kevin. Obamacare doesn't have a serious impact on the economy, as many people would like to believe. The Affordable Care Act is unlikely to have a major aggregate effect on the U.S. economy, primarily because the changes in spending and taxes are quite small relative to the size of the economy. Increased spending will increase the demand for health services and the demand for labor in the health sector. The impacts on small businesses are likely to be insignificant because most small businesses will be exempt from any penalties. Small businesses should benefit from the availability of lower cost plans and efforts to increase competition and contain costs within exchanges. The net effect on employment is likely to be slightly positive because the health sector is labor intensive. Cost contaminant efforts should reduce the growth in spending on Medicare and eventually on Medicaid, which would reduce the taxes or borrowing the federal government has to undertake. The impacts on small businesses are likely to be insignificant because most small businesses will be exempt from any penalties.
Wow, sort of like a canceling effect, with even some layover in the labor force to promote a small shift right for the economy. For healthcare in general, the supply and demand curve can be tricky. So let's explain the healthcare supply and demand. Here is the supply and demand for healthcare. Q1 and P1 are the equilibrium quantity and price, respectively. Price 3 represents the out-of-pocket expenses for patients, and Q2 the quantity demanded at P3. But Q3 is the quantity supplied at P3. In order for both quantity supplied and demanded to be equal at Q2, supply has to go up. But in order for supply to go up, prices have to go up for suppliers too. Thus, consumers get low prices, suppliers get high prices, and insurance pays the difference. Q2 and P2 are the quantity and price resulting from increased healthcare costs, which results in increased healthcare spending overall.
That sounded like a 5% analysis if I ever heard of one, Pat. So now to discuss the bad side of Obamacare, we welcome back Republican Jimmy Zubert for a graphical analysis.
Now that we have the basics down, here's the deeper picture with Obamacare. So now I'm going to draw a graph to explain what is going on with Obamacare. Here's a basic supply and demand graph that you often see in our macroeconomics class. Here you have where supply equals demand, aka market equilibrium, maximizing social welfare. Here we have profit maximizer, where marginal revenue equals marginal cost. The problem is there's dead weight loss right here. This shows there's uninsured Americans. What Obama is trying to do is this. This many people want to have health care, so he's promising to give them this much health care to the people. The problem is that this costs too much. Obamacare is trying to set the premium very high so that people on the lower end here can afford health care. This is how Obamacare is willing to pay, and this is how much Obamacare is charging. It forces everyone to pay a much larger premium than they're willing to offer. They are trying to correct the dead weight loss by marketing everyone to pay a much larger amount.
And now to discuss the canceling effect, once again, we welcome back Democrat Ryan Lowry to give some analysis as well.
Thanks, Pat. Before I talk about this graph, let's keep in mind that we are assuming ceteris paribus, which means we are holding everything else in the economy to be constant. Obamacare is said to allow more Americans to have access to healthcare and buy more health services. If we assume this is correct, this will cause demand to increase for healthcare at any price level. The graph also shows that what will happen in the healthcare market. Both price and quantity increase, comparing the two intersection points of the supply and demand curves. This increase causes the graph to shift rightward, which means all healthcare expenditures will increase. Now let's look at it a different way. This graph demonstrates the effects of price controls. Controlling the price can cause a shortage. The dotted line with the arrows at each end displays the size of the shortages that result in. However, with all these canceling effects I mentioned previously in my analysis, we'll have some economic growth that the Republicans fail to acknowledge.
There's some cool viewpoints indeed.
It is no secret that ever since its installation back in 2010, Obamacare has affected the economy and healthcare of the Americans. It seems to be a problem that is not going away. No other country spends more of its GDP on healthcare than the United States of America, and the effects of a higher premium rate and taxes on the consumers for more universal healthcare is on display today. There are many instances where people would die without the use of Obamacare. Take this man, for instance, whose life was just saved because of Obamacare and its policy.
58-year-old Jerome Williams is one of those heart patients at Chap Care. Williams' ordeal began recently when he got sick one day and couldn't breathe. This preacher and former construction worker, who admits having no money and living paycheck to paycheck, was rushed to the hospital with congestive heart failure. An LA County hospital, which we won't name, kept him there for a while. However, the hospital refused to do the required surgery to save Williams' life.
I was at the hospital for 15 days before they transferred me to a different hospital.
Why were you transferred to a different hospital?
Because I didn't have health care. I didn't have health care at the hospital I was at.
And so they wouldn't accept you?
They wouldn't do the surgery. All they did was just monitor me.
Williams says he got sticker shock when he got the hospital bill.
They sent me a bill for $153,000.
$153,000?
For 15 days.
For 15 days?
Yes, sir.
When you saw the bill, what'd you do?
I started laughing. Where am I going to get that from?
You didn't have $150, let alone $150,000.
Man, $1.50 at that time.
Eventually, Williams had the surgery at a different facility, and then after recovery, he was directed to CHAP Care, so doctors here can now monitor his heart condition for the rest of his life. You don't have any money. How do you pay for it here?
Well, this is that's one thing Obamacare does for me. That's one thing that it does for me. It makes sure that my family still has a dad around, and my church still has a deacon around.
That was it right there. I think that's what I wanted. I wanted to end right there anyway.
So we're gonna end right there.
End right there anyway.
No one should be denied the privilege of life just because they don't have enough money in their pockets to afford healthcare.
Right you are, Kevin. In closing, there are numerous pros and cons that Obamacare brings to the economy.
While increasing taxes and subsidies, the supply for healthcare is being issued to match the demand of healthcare.
The cost of each American will increase while also providing more coverage nationwide. Over the last 5 years since being installed, the economy has grown around 2.3% each year, which is around the quota America shoots for.
It has given numerous businesses trouble and caused wage cuts to match the higher supply along with the higher premiums.
Now, we have given our input on the pros and cons of Obamacare and have given the graphs to provide further analysis. We give special thanks to our economists Ryan Lowry and Jimmy Zubert for giving their graphical analysis.
We would like to pose questions to you, the viewers. What do you think of Obamacare, and how has it affected you for the better or worse? What questions do you have for us? Let us know at our email, theeconomicperspective@econ.com.
As always, we wish our viewers a wonderful evening. Thanks for dropping by to The Economic Perspective.
Flamers! Drama. I got him. Beast.
It's your boy LG.
I said, you be with a lame bitch. I be where it's poppin' at. Money